So the question is, most of the time, whatever disc protrusion patient we are getting, if you see their MRI, you will find out one thing is very common, like more than 90% cases, one thing is very common. They have disc protrusion. If the disc is pinching some nerve over here, they have radiating pain. That is fine. This is one part of the problem. But the problem is when patients coming with the disc protrusion, they have radiating pain. Sometimes they don't have radiating pain, but they have pain in this area on the lumbar spine or sometimes glutes also. That is like a protective spasm. Our brain is trying to protect that area, so surrounding muscles, tendon, ligament will be a little bit tighter. That can lead to a little bit what I have to say, like spasm, tightness, less blood circulation, which leads to some other issues also. I'm not going to discuss about those things. So what I want to focus over here, like this is your lumbar spine, this is the disc. So disc is carrying more or less 75 to 80% of your body weight, and 20% body weight is going through your facet joints, these areas. When your disc height, generally in cervical spine, is 5 millimeter in an average, thoracic is 7, lumbar spine is more or less 10 millimeter on an average. If you're going to the downside like L5, S1, the disc height is a little bit more. If you're going for L1, L2 level, that disc height is a little bit less. So it's according to our body weight and all this. On an average, 10 millimeter is the height of the disc. So if you have some disc protrusion, so this height and this height, if you're going to compare, this is a little bit less. So body weight is going more through this side. See this gap and see this gap. But this joint, this facet joint is not built for weight bearing. This is for weight bearing. So 80% body weight is going through your intervertebral disc, and 20% more or less on an average weight goes through your facet joint. When your disc height is reduced, more weight is going through this joint, and this is not a weight bearing joint. What will happen? Surrounding area, what other ligaments are there? Ligamentum plebo. So that ligament is getting a lot of stress because body weight is going through that area. So they are trying to protect this joint. So what will happen after a couple of weeks, or might be after some time, that ligament will be inflamed, which will create a lot of issues. If it's going to inflame, surrounding nervous structure will be got compressed. It will create the same issue like disc protrusion. If this area got inflamed, there will be some inflammatory changes is going on to this area. This muscle will go to the spasm. That is also creating like oxygen starvation in the tissue level, which can aggravate those trigger points. Fascia will be tight. So it's like a cascade of problem. So if you are focusing only on disc protrusion, like you're going for McKenzie exercise and all this, that will help. It's not like it's not going to help. But if you want to cure 100%, you have to focus on this area also. So what do you have to do? You have to plan accordingly, according to the patient condition. So that's it.